I know that medical terminology can be difficult sometimes and medical terms often sound overly complicated, but in this video, we're going to learn specific suffixes that will enable us to understand the meaning of many medical terms without having to memorize each one separately. I'm Dr. Shaima, and at the end of this video, there will be a quiz where we can practice what we have learned. And I'm confident you'll be able to score at least 80% just by watching the video without having to study. So let's get started. The first suffix we have today is the suffix itis. Now, itis means inflammation. So as a suffix, it always comes at the end of the word. So let's take this example, hepatitis. When we read a medical term, we actually read it in reverse. So we start at the end with the itis and then go back to the beginning. So itis is an inflammation and hepat refers to the liver. So hepatitis is an inflammation of the liver. For example, look at this joint here. This joint is inflamed, red, swollen. That is called inflammation of the joints, itis of the joint, which is arthritis. So this, of course, leads to pain and difficulty moving. So remember this one. The next one we have is oosis. So oosis refers to an abnormal condition. It doesn't specify what the condition is. It just indicates that there's something abnormal happening in this organ. For example, look at this finger. It looks bluish, right? That is not normal. So there is a condition of bluish coloration of the fingers. So cyan means blue in Latin. So we call this cyanosis. As we can see here, the finger is turning blue. Next one we have is pathy. So we have a more general suffix that is called pathy. So think of the word pathology. Pathy means a disease. So whenever you see pathy, you should understand that there is a disease in this specific structure. For example, a disease of the nerve is called neuropathy. You can see here that this is the normal nerve structure versus the one on the other side where the myelin sheath surrounding the nerve is peeling away. So this is a disease process happening in the nerve. So this is a neuropathy. If this pathy happens in the kidney, for example, which is referred to as nephro, this is called nephropathy. Nephropathies. A third example, we have the retina inside the human eye. This is the normal structure of the retina, but here we have a disease process going on. So what do we call this? Pathy of the retina, so this is a retinopathy. Summary so far, we have itis, inflammation. We have oosis, abnormal condition like cyanosis. And we have pathy, a disease like neuropathy or nephropathy. Next, we have emia. Emia is a very common one. Emia means related to the blood. It is a blood condition. For example, if we want to say that there is sugar in the blood, we say glycemia. If you want to say that there is calcium in the blood, we say calcemia. Next, we have oma. Please don't be confused when you see oma, because some people think that it always means cancer, but it actually means a mass or an increase in the size of the tissue. For example, we have a lipoma. This is a mass formed of lipo, which is the lipid or the fat tissue, which is a benign tumor, a non-cancerous tumor of the fatty tissue. We also have carcinoma, which is another oma, but this one is cancerous and malignant. Carcinoma invade and spread to other parts of the body, while the benign masses like lipoma stay localized and are generally okay if left alone. Another example is hematoma. This is not a tumor, but it means there is a mass, specifically a collection of blood that often results from trauma. Next one we have seal. The suffix seal means a protrusion. So this is a tricky one. What is the difference between an oma, a mass, and a seal, a protrusion? In an oma, there is usually an overproliferation of cells, extra tissue. However, in a seal, the organ itself might be normal, but it has protruded or pushed outside the space where it belongs. For example, this brain tissue, as you can see here in this image, this is not a mass of extra cells or extra tissue. This is a normal brain, but it has protruded outside of its normal cavity. So we call this an encephalocele. Encephalo means brain. Another example we have, of course, is hernia. When there is a protrusion of the intestine and the fat surrounding it through the abdominal wall, the muscles in the abdominal wall becomes weakened. So this allows intestine and the fat surrounding it to protrude through this weakened part. Next, we have ptosis. This means drooping of an organ. This is very common in the eyelid. When someone has a drooping of the upper eyelid, we use the term blepharo for the eyelid, and then ptosis. So blepharoptosis means drooping of the eyelid. Remember, the P is silent. So far we have covered emia, a blood condition. Oma, a mass, like a benign lipoma, or a malignant carcinoma, or blood collection hematoma. Seal is a protrusion of an organ, like an encephalocele or a cystocele, which is a protrusion of the urinary bladder. And we have ptosis, which is drooping, like blepharoptosis. The last group of suffixes we have is, first one is sclerosis. Sclerosis means hardening. You have likely heard of this regarding the arteries. So the normal artery should have a smooth lining to allow for the healthy blood flow. However, when there's an excessive buildup of fats and lipids on the inner wall, it's called atherosclerosis. Another thing it can happen also in the blood vessel is called spasm. So spasm is a sudden involuntary squeeze. So we can see here the difference between the vessel when it is relaxed and the spastic one. Do you know where else a spasm can happen that can actually be life-threatening? I'll give you a second to think. Yes, exactly, in the airways. People with certain respiratory conditions can experience bronchospasm, where the bronchi, the airway themselves, squeeze and become narrow. So this next one we have is penia. If you think of being penniless, this just means like you don't have enough money. So penia means a lack of something or a deficiency of something. If someone has a low white blood cell count, we call this leukopenia. So leuco means white. So now we have learned two colors in Latin, the cyan, which is the blue color, and leuco, which is white. The next one we have is phobia. So phobia means fear or sensitivity. So people having, for example, claustrophobia, the fear of enclosed space. Another phobia is called photophobia. So photophobia is not a fear of light, but it's a physical sensitivity to light. It happens in certain eye condition when the eye becomes painfully sensitive to light. So we call it photophobia. And then we have the last suffix for today is plegia, which means paralysis. Plegia, paralysis. So hemiplegia means paralysis of one vertical side of the body from head to toe. Paraplegia, paralysis of both lower limbs. Para means next to or besides. Quadriplegia, paralysis of all the four limbs. So quad means four. And now for the quiz. So a patient has a drooping of the upper eyelid. What is this called? Blepharoptosis, exactly. So this vessel shows a yellowish fatty plaque and narrowing of the passage. What is this hardening of the vessel called? Exactly, atherosclerosis. Well done. Next we have, this lab has a significantly low count of white blood cells. How do we say this? Leukopenia. Exactly, okay? Next one, we have, this patient is protecting their eyes from the light because the light causes physical pain. What this sensitivity to light is called? Is it phototosis, photophobia, ophthalmoplegia, hemiphobia? Exactly, photophobia. Okay? After a stroke, this patient is unable to move their entire right side, the arm and the leg. What is this condition called? Half body paralysis. Exactly. Half hemiparalysis plegia. Hemiplegia. Okay? Next we have this. There is a narrowing of the airways of the bronchi. What is this called? Bronchospasm. Okay? Patient paralyzing from the waist down. So both lower limbs are paralyzed. This is called paraplegia. Exactly. Para means besides or near. Erythro, this is a new one. So erythro refers to red. So when we say erythropenia, most likely what does this mean? So penia is a lack or deficiency. Erythro red. So there is a lack or deficiency of the red blood cells. Exactly. Okay. And this image shows a person standing in a very small elevator looking extremely panicked. So this person is having claustrophobia. Okay, this person having paralysis of both arms and both legs, all the four limbs. So we have quadriplegia. Okay, now we are done, and I hope this video was helpful, and see you in the next video.